is digital the cure for all ills? Oh, I mean, we're obviously converts. We're here. We're the digital advocates, I assume. We've bothered to take the time, the expense, the hassle, coming here, and I'm sure it's worthwhile. But we're a relatively small minority of people, and we're only small representatives of the industry. So is digital really the cure for the patient, i.e. farmer? Well, before we can discuss the cure, we of course have to come to a diagnosis. So what conditions, what afflictions is the pharmaceutical industry suffering from? Well, we heard about some of them yesterday, and you know, I think you could summarize them into at least 3 different ailments that are afflicting the industry at the moment. One of them is a loss of moral virtue, i.e. lack of trust. So the industry, and it's not alone, other industries have got this problem too, have lost the trust of patients, lost the trust of regulators, healthcare systems, and healthcare professionals. And it needs to see how can it regain trust, how can it regain its moral virtue so that people want to work with the pharma industry. The industry is regarded as a pinnacle of industrial success. And how to, in other words, regain trust with all those stakeholders. Second is the industry got a bit obese. The blockbuster era meant there was a time of plenty and the industry fed very well. Over the last few years, most pharma companies have had to undergo some fairly radical surgery, some pretty significant liposuction, and get rid of some of that, trim that excess fat off. So is digital helping the industry to be leaner, to be more agile and effective, and to be able to compete in the environment that we're now in? It's just off the bottom there, but there's also, along with obesity, often comes a lack of fitness. And Brian Smith yesterday talked about evolutionary science and the fitness. Is the industry fit enough? How can it train so that it is able to really succeed, to deliver better healthcare, to improve the experience for patients, to improve healthcare outcomes, and to make the world a better place? Well, before we do that and answer those questions, I want to play a round of Have I Got News For You, which is a new one I've just invented. This one is the things people say. So I want to discuss 5 things that I hear people saying. Now, I'm not saying I disagree with all of them, but I think it's interesting to look at them, because sometimes we repeat things, sometimes without really thinking about what they really mean, and do we really agree with them. So a lot of people say content is king, and I know Denny talked about this yesterday. And do you know who coined the phrase? Young man, Bill Gates, in 1996, coined the phrase. And it was a short essay, and he got a lot of things right. He talked about the gold rush of the internet, how people would be flocking to publish stuff online. So Michelle talked about was it 24,000 websites in 1996? There's so many now. He talked about how the internet would challenge traditional industries like the print medium. He talked about the benefits for clinical research and scientific research. He foresaw a lot of that, but he also foresaw that it was going to bring its own challenges. And people often talk about content is king, but I think often they forget something. Let's just see if this works. But in the next 60 seconds, there are going to be about 2 million clicks on Google searches, about 30,000 photos uploaded on Instagram, I don't know, 300,000 tweets, not all from here, but a few from here, 2 million Facebook likes just in a minute, 200,000 photos onto Facebook, of which there'll be something like 700,000 likes. There'll be 6 new Wikipedia articles just in the next 60 seconds. 204 million emails will be sent, of which 65% will be spam. 100 hours of videos will be uploaded in 60 seconds. And 3 million views of YouTube videos, of which I just failed to make one, in 60 seconds. So the point is that the internet has become this vast repository of content. And so when we say content is king, we need to think about the fact that there is such a daunting amount of content out there. How is our intended audience going to find it and find it useful? And often people who say content is king often say this phrase too: if you build it, they will come. Do you know where that phrase comes from? It's a film.
Field of Dreams.
Field of Dreams. And actually, Kevin Costner didn't say, if you build it, or if I build it, they will come. He said, he will come. Yeah. But it's an often quoted phrase. But if that's your marketing plan, I'm afraid it's likely to be one of the 70% that doesn't work. So the questions we should ask when we're thinking about content, and here's some suggestions. How will it achieve my marketing objective? That's pretty simple, isn't it? What is the best type of content to do this? Of course, we'll have those conversations. What does it say about my brand? I'm sure most of us think about that. And increasingly, people are talking about how will it reach people? How will it reach my target audience? So people, I think, are talking about that. But we also need to consider those other two questions on the right. Why will it connect with my target audience? What is it that's going to resonate with them? How do I make this content stand out and appeal to them to fulfill a need? And just as importantly, why will they care about it? And I think a lot of marketing campaigns are too much focused on the left-hand side, which is what you care about as a marketeer, and not enough about what your audience cares about, which are the two on the right. So content is king, but I think you need to be very careful that you're not thinking about the content you publish, but how you're going to engage the users with the content and why they're going to care about it. So the next phrase a lot of people say is, only young people do digital. Now, I think people are saying that less and less these days, and I'm sure no one in this room really thinks that. And we all know that patients are using the internet to look up their symptoms, even before they go to see their doctor. That doctors and other health care professionals are all using the internet. Doesn't matter what age they are, when they graduated. It's part of professional life. It's part of our life as patients and consumers. And here's an infographic from Blue Latitude and BMS, which points out that 2014 will be a tipping point for doctors and digital. In other words, more than half of the practicing population of doctors will have had all of their professional life within the digital era. That's quite something. So rather than there being more digital immigrants in the healthcare professional world, there are going to be more digital natives. So digital is normal. Phrase number 3 that we often hear people saying, pharma needs to learn from the consumer world. Now I do agree with that, and I think there are some important lessons that we can learn. One of them is that the pharma industry can see what works in the consumer world and see how it can adapt and make use of that. And the other, of course, is that it can see what fails in the consumer world and try to work out how not to make those same mistakes. But one of the things that the consumer world has learnt is the best way to engage your customer is not to create a website, this most fantastic website with all this content, and expect people to come to you, but you must also publish your content, go out to where your users are. I've never been to websites like Coca-Cola or Nike, but I see their branding all the time on all the other websites that I use. So let's have a look at, shall I try?
Ship my pants, you're kidding. You can ship your pants right here. You hear that? I can ship my pants for free.
Wow, I just may ship my pants.
Yeah, ship your pants. Billy, you can ship your pants too.
I can't wait to ship my pants, Dad.
I just shipped my pants, and it's very convenient.
Very convenient.
I just shipped my drawers.
I just shipped my nightie.
I just shipped my bed.
If you can't find what you're looking for in store, we'll find it at Kmart.com right now and ship it to you for free.
A very effective consumer ad was published earlier this year on YouTube by Kmart. Their agency made it. And in less than 5 days, over 10 million views. And a very dull subject, online shopping. But the way it was marketed meant that it really captured the imagination. They've subsequently had campaigns like Big Gas Savings and other campaigns, so really creative agency there. But the consumer world often gets things wrong. I'm not going to show you the video because it's not that tasteful, but Hyundai published a YouTube ad with a guy who being shown tried to commit suicide by sitting in a car, putting a flexible pipe on the exhaust pipe and sitting in the car waiting to succumb to the exhaust fumes, only to discover that he's sitting in an electric car. And you can see somewhere along the line someone thought that was a good idea, but really somebody should have said pretty early on, that's not a good idea. There are some bad pharma social media adverts too. I think it's I haven't put it here because it's, but if you want to go back and look up the Viagra ad on YouTube, that's a pretty bad example of social marketing. So the industry can learn from the consumer world about how to engage customers, how to go out to your customers rather than expecting them to come to you, how to use social media and other tactics successfully, and how to do things unsuccessfully. So how does that work in healthcare? And doctors are pretty, are they really interested in social media, and do they want to get information from the pharmaceutical industry? Well, this is how a website in Japan, m3.com, allows doctors to choose to get messages from pharmaceutical reps. Now, these aren't real reps, these are virtual reps, but you can see there's a little avatar there. And so when a doctor is using the m3.com website, which they're using for lots of purposes, education, information, looking up stuff, news, etc., and talking to other doctors, on the right-hand side, they get invitations from the pharma virtual reps to engage with them. They can ignore those. They can say, I don't want any more invites from that particular company or that particular rep. But they then are given the opportunity to look at some information. They can look at a blog, they can look at some videos, or they can look at whatever piece of information is being sent in that message to them that day. And if they want to, they can then move on and have what you might call a virtual detail, by either talking to a rep live or by looking at recordings, and they also have things like virtual symposiums. And Japan is actually the place in the world, the single country in the world where most e-detailing is taking place right now. So Japan, that's partly because Japan is the second biggest pharma market in the world, but it's also because the doctors in Japan and the industry in Japan have really adopted digital, and they're making use of this channel. So if Japan is leading the way, is digital going to replace the sales rep? And you do hear people saying that, and maybe people here think that. And I saw a question yesterday on Twitter about if the industry was to start again, would we employ sales reps? I think that was UK. It's a very good question. But will digital replace the sales rep? Well, I don't think it's such a simple question. Of course, it's a complicated question. And going back to Japan, if you ask Japanese doctors how do they receive medical information, digital versus from a rep, this is what they say. Most of them are saying that they get most of their information from digital, but they're also getting it from reps. Only 3% are saying they only get it from digital. And I think this is really interesting because it's showing that although Japan has got a big adoption of digital engagement, most of the doctors' experience is of having multi-channel, of being able to talk to somebody and also get information online. And I think really that's the most likely sweet spot, the best combination for engagement. So I don't think digital is going to entirely replace the rep, but I think it can really augment, complement and integrate with the rep. Sadly, I think a lot of digital initiatives are done entirely separately from the rep force. And sometimes what that means is that the rep force feel threatened by the digital initiatives, that they're not coordinated with it, that they're certainly not supporting it, and they're worried that the digital initiatives are going to cost them their jobs. And the way these things have been set up, it's not surprising that they think that. So in Japan, this is what's happened. The green lines are the volume of sales reps visits, so the number of times a doctor in Japan sees a rep globally, and the blue lines are digital interactions. Now, the reason they can do this analysis is that, unlike in the EU, in Japan as in the States, when a doctor engages with pharma information online, they give their consent for their name to be passed back. So it goes into the CRM system, in this case, IMS. And so what you can do is you can directly compare interactions with your target audience digital versus the rep force, and you can see that digital is now accounting for about 24% of total pharma interactions with doctors in Japan. I don't know when it's going to settle out, but I suspect it's going to grow more. But I don't think it'll ever be the case that it is 100%. Now, Ragnar yesterday showed a pyramid, and this is pretty much the same pyramid. So if your pyramid is showing you your target audience with the high prescribers or high value at the top and the lower at the bottom, there's a break-even point, and as Ragnar described yesterday, that break-even point has gone up, the paradox, where the cost of engaging with doctors or whoever your target audience is keeps increasing. So you can't afford to adopt those high-cost sales tactics for the low prescribers because they simply don't provide you the return. So the break-even point for the real MR, the real medical representative, is that line there, the top dotted line. What digital allows you to do is to have a separate break-even point for your digital engagement with your target audience. So what you can do is you can focus your sales reps or your key account managers, whatever you want to call them, on your really high-value customers, on the payers, on the prescribing leads, on the decision makers, and you can use digital to be broadening your reach and reaching the low prescribers. And what that can mean is that you engage with doctors that you probably may not have thought about engaging with before because it was too expensive, it didn't justify the rep force. So you can go to prescribers who are much lower in terms of their value from a prescribing point of view, but still have effective engagement that produces an uplift. And fifthly, it's really hard to prove the value of digital. Now, this is probably the phrase that I hear most often these days, and it is tough to prove the ROI of digital sales and marketing campaigns, but I don't think it's any more difficult to prove the ROI of digital than it is to prove the ROI of anything else. And I think there are two really important reasons why people find it difficult to measure the ROI. The first one is that they don't set up programs in order to be able to do it. So they set off with great enthusiasm to do a campaign, and they don't think at the start, how are we going to set this up so that we can measure the return on the investment? And the same thing happens in life. If you set off without ever working out what is important to measure, it's very hard to work out. And the second is that often people are measuring the wrong things with digital. And if you measure the wrong things, it makes it very hard to really work out, have you got the right value out of it? So what can you measure in digital? Well, clearly you can measure page impressions. And page impressions tells you volume, so it's useful to know, but it doesn't tell you a lot more than somebody has looked at it. You can look at unique users, and you can have authentication mechanisms to find out if they are your right target audience. And clearly that's useful, so are the right audience looking at the content? The next thing people often do is to talk about time spent. And they think, well, if I've got the right person to look at that content and they spent, I don't know, a couple of minutes looking at it, that must be good. They must have taken something in. But I think that could be a really specious measure. And I think it's very analogous to measuring the effectiveness of your rep force by how long their car sits in the hospital car park. Because, great, the rep's car is in the car park. That probably means the rep is in the hospital talking to the right doctor about the right products, and the doctor really wants to hear about it. Might be the case, but it could also be the case that that rep is sitting in the waiting room and hasn't been able to see the doctor because the doctor's clinic is running late. It might be that they're having lunch. It might be that they just find it's convenient while they go to Asda. So you don't really know if that's really a good measure of an effective interaction with the doctor. And it's the same for looking at the time spent on a web page. I'm not saying don't measure it, I'm just saying be very careful about how you interpret it. So what else can you do that's more useful? Well, you can build interactivity into your pages, whether it's an app or a mobile optimized page or a web page or whatever you're using, and you can get some information back about the doctor. That tells you that the doctor is awake and the browser is the one they're actually looking at, and it gives you some information about their response. What does it mean to them? How do they feel about it? And we've seen some examples during the conference. So that's very useful. But really the gold standard is looking at sales data. So can you look at sales data and be able to prove the ROI of digital campaigns? Well, there's two circumstances when it gets quite easy to do that. One of them is if you only do digital for your sales and marketing for a product. That doesn't happen very often, but here's an example from the UK where a company launching a new product in the women's health market decided that they would just do a digital-only launch. So we can be sure that the IMS data here is entirely due to the digital campaign because they didn't have any reps. And you can see, this has been running over the last 12 months, you can see a dramatic sales uplift, about 20% month on month at the moment. So that's one way in which you can see the impact on sales if you're only doing digital, but quite often that's not the case. The other way you can do that, and this is from Japan, is if you carefully construct your program so that you only use digital for one group, or you only use the sales force for one group, so that you've effectively got a control. And you can see here a program where they had a group of target doctors, one who were engaged with the digital tactics, the virtual rep that I told you about, and one who weren't. And you can see a clear difference which is beginning to widen by the beginning of this year. So it is possible to measure the ROI of digital. So going back to our patient with loss of virtue, obesity and lack of fitness, is digital the right treatment? Well, I honestly don't think it's the cure, but I do think it's an important part of the treatment for the patient in terms of being able to rebuild trust, and we're going to hear from Shona about MSD's experience in providing non-commercial client to HCPs and the value that what that's done for that organisation. There's a lot of value of providing high-quality content that really can rebuild trust and credibility for your company and for the brands. It can help the pharma industry to be able to be leaner and fitter and more agile in the current climate, to be able to respond to the fact that there aren't blockbusters coming and that the products that are coming out need to be marketed at lower cost to get the returns. And it can make the industry fitter and able to be more adaptive, to be able to move quicker and respond to market conditions. Thank you very much.